So, I'm really excited to have you here. Tell everybody what your specialization is.
Okay, I'm a medical doctor, psychiatrist, psychotherapist. I'm international master trainer on positive and transcultural psychotherapy from World Association of Positive Psychotherapy. Usually I have two main activities. I take patients, help them to maintain better quality of life, and I teach positive and transcultural psychotherapy.
And we've been talking earlier that really a lot of people confuse positive psychology and positive psychotherapy.
Yes, that's correct.
Not at all the same.
Yes.
Tell us about that.
Yes, that's different schools. Positive psychotherapy was created by German professor with Iranian background, Nosrat Pizeshkian, in 1968. Positive psychotherapy is psychodynamic method with humanistic image of man. So we believe that man is good by nature, and we help them to balance their life, to analyze their difficulties. We used to say that the healthy person is not the one who is free of problems, but the one who can deal with them. So that's the main idea. Positive psychology is a psychological movement that's very popular in US and some other part of the world. That was originated in the late 90s. Okay, we have some things in common, but this is quite different schools.
What are some of the, what do you think is the most important difference between the two?
Okay, the main, I would say, the deep thing about positive psychotherapy, the word positive derived from the Latin word positum, that means the factual, the whole, the given, not good, but the whole. Okay, so this is where the word positive comes from. It means when you get a problem or symptoms or disorder, it's not the only thing that is factual and given. You also have capacities behind. It means that all difficulties or symptoms considered from the point of a way of dealing with problems. So this is a available way to deal with the problem. So we see not only what is lacking, but also what is there, what capacities are behind the symptoms and disorders.
And you run a practice in Russia.
Right.
Tell me about how you made the decision to open a clinic.
Wow, that's a long story. I dreamed to be a psychiatrist. And in a medical university, I chose to be a psychiatrist, and I entered some additional training on psychiatry. And I was very active, participating in some different conferences. And I became a psychiatrist. And when I became a psychiatrist, I was not satisfied with what I got, because the way they treat people is totally biological. I didn't find it very humanistic. So I was looking for something more friendly to people. And because I was so active, I was invited to psychotherapeutic clinic to work at the suicidal ward. So I entered there, and I found out that there are different possibilities to offer psychological help. At that time in Russia, it was very difficult to find a good, profound trainings. So I was entering and looking for any possibilities to get knowledge. So I was practicing hypnosis first, and then studying psychoanalysis, transactional analysis, and some other psychodrama and so on. And then finally I found out the positive psychotherapy and fall in love with this. And I went to Germany to study long-term training program on positive psychotherapy. Okay, and I worked at that time. I used to work at the mental hospital. And we had a lot of very difficult regulations that it was not very comfortable to work there. Yeah. And I was paying for my education myself. Nobody did pay, so it was just a matter of time when I'm gonna leave that this hospital and open my practice. But I stayed in the hospital for a few years, obtaining some experience. And in 2001, I started my private practice, and in 2003 I opened my own clinic. So at that time it was just me and my colleague. Now we have 11 people working together. We're offering psychotherapy for adults and children and adolescents. And I never regret. This is I'm happy about this because I love my work. You know, we used to say, if you find a job you like, you never work a day. You're just enjoying it.
Yes.
So I travel around the world offering trainings. I work as an international trainer from Wiesbaden Academy for Positive and Transcultural Psychotherapy. This is it.
Yeah, and what were the most important lessons you learned as a business owner opening a clinic?
Wow, there are a lot of responsibilities, but you see, when you have strong values in your head and you get quite a good plan what you're gonna bring to this world, it helps you with the orientation. And you're quite free, you know, to do that. You can choose what you focus on, what you stay with, what you get rid of. Okay, so this freedom, you know, I used to say that freedom is an ability or possibility to choose your limitations. So when you choose your limitations, you are free. When someone else does, that is not a freedom.
Yes. Wow. And how do you feel like your community has responded to you bringing psychotherapy that way to your community in Russia? Like how the people respond?
Well, the tradition of psychotherapy in Russia is not very deep. So when I started psychotherapy in late 90s, people were not very open to psychotherapy. They actually had no idea what is this. A lot of people would, you know, think about psychotherapy as something like shaman practice or, you know, psychiatric help or whatever. But in Russia, psychotherapy now is a profession where in order to be psychotherapist, you have to be medical doctor, psychiatrist, and then you become psychotherapist. But other parts of the world, anyone can call themselves psychotherapists because it's like something. In Europe, psychotherapist is a brand. It means you're certified, licensed, you know, you got all education, but not in many countries. So they're still in the world, they trying to identify the profession. So you could see that there are different kinds of professionals offering psychological help, like counselors, psychologists, psychiatrists, coaches, life coaches, and the mediators. So really a lot.
Yeah. And once you started really being able to convey to people in your community what psychotherapy was, like how excited were they to like actually like participate in it, knowing that like how transformative?
It was a long way. I used to give talks on TV and on radio, write articles about what psychotherapy is, because when I went to Europe, to Germany especially, to study psychotherapy, they have long tradition of psychotherapy, very deep roots, over 200 years. So the first thing I was really interested in, how the room looks like, you know. When I came back to Russia, I changed my dress. I rebuilt the room. So I started the practice according to my new understanding what psychotherapy is, like offering help, make a comfortable conditions for people to talk about something secret. Okay, so then we started to gain some good reputations, because when people come for help, they expect pills, you know, sometimes medication, and then, but the 90% of them don't need any medications.
Yes.
Absolutely. And at least you give them a choice. You know, do they want to use their brain or just mouth?
Yeah.
Okay, so slowly we got good reputation, and people like to visit psychotherapy. Some of them speak out loud about their experience with psychotherapy. Some of them keep it secret because they're afraid of, you know, what other people would think about them.
Wow. Wonderful. And if people wanted to find out about having you come and speak on positive psychotherapy, how do they contact you, or how do they?
Well, you can just easily Google my name, Maksim Goncharov, or you can find Positive Psychotherapy, World Association of Positive Psychotherapy. We have a YouTube channel with my name and the Positive Psychotherapy. Actually, this is very important thing, I guess, to share your ideas and help people to choose what they really like. Because let's say if you go to dentist or any other doctors, you're quite sure what is going to happen there. You can imagine how this work would look like. If you're going to visit psychotherapists, you have no idea what's going to happen there. So what this depends on? This depends on this professional identification. You know, like are you psychoanalyst or positive psychotherapist or any other? So, and people have to learn more about this, how the psychotherapy looks like, to be more aware what criterion they choose to pick up psychotherapist. Yeah.
Yes, we are telling our clients constantly, teach your communities, teach them how to choose, what questions should you ask,
right.
Articulate what you do and how you do it, because that just is so impactful. So I'm like cheering for you right now.
We just last year we wrote a book for clients, for just normal people, that called "Why Psychotherapist is Better Than Friend's Shoulder." So it just simply explains how psychotherapy looks like, and also we give 33 advices how to apply your psychotherapists, because people don't know how to behave, you know, what to do, and we want them to be firm, you know, to be confident in getting this help, because they are the main person in psychotherapy.
Yeah, and that I love it when therapists complain, oh, I get these bad clients. No, you haven't educated.
You make them bad, huh?
Yes, it's up to you, because you set the stage. Because what do they learn on television about psychotherapy? You know, it's like you're just going to go in and complain for an hour, or the person doesn't really care about you and just going to take a lot of money and say, oh, time's up. Or that you're going to have sex with your clients. Like, I hate that. I hate that stereotype.
You see, that's another thing. In order, as Freud said, if you want to practice psychoanalysis, don't do just psychoanalysis. You know, have the normal life outside of your profession.
Yes.
So this is actually what we teach in positive psychotherapy. We have this balance model that says you have 4 dimensions of life: your health and body, dimension of your work achievements, dimension of your social contacts and relationship, and domain of worldview, spirituality. So when you keep all these 4 dimensions in life, your life is balanced.
Yay! Thank you so much for coming and talking with us today. Like, seriously, you're awesome. We'll share all the information below this. So.
With pleasure. Thank you.
I almost forgot one really important question that we ask everybody. If you could give one piece of advice to other therapists who are in private practice, what would that one piece of advice be?
Never stop to develop. You know yourself better, because the main tool we use to offer help is our own psychological, emotional health. So keep it updated.
Yeah. All right, awesome. Thank you.